Which of the following is a common feature of premature ventricular contractions, PVCs, on an ECG? A. P wave preceding the QRS complex. B. Narrow QRS complex. C. Wide and bizarre QRS complex. D. Regular RR interval. Answer: C. Wide and bizarre QRS complex. Explanation: Premature ventricular contractions, PVCs, are characterized by wide and bizarre QRS complexes on an ECG. This is because the ventricular depolarization does not follow the normal conduction pathways. Which type of premature contraction is often associated with a compensatory pause following the ectopic beat? A. Atrial premature contractions, APCs. B. Ventricular premature contractions, PVCs. C. Junctional premature contractions, JPCs. D. Sinus premature contractions. Answer: B. Ventricular premature contractions, PVCs. Explanation: PVCs are often followed by a compensatory pause, which is a longer than normal interval before the next normal beat. This occurs because the SA node resets its rhythm after the premature beat. What is a hallmark feature of atrial premature contractions, APCs, on an ECG? A. Wide QRS complex. B. Absence of P wave. C. Early P wave with a normal QRS complex. D. Prolonged PR interval. Answer: C. Early P wave with a normal QRS complex. Explanation: APCs are characterized by an early P wave that usually has a different morphology than the sinus P wave, followed by a normal QRS complex if the AV node conducts the impulse normally. Which of the following is a common symptom experienced by patients with frequent premature ventricular contractions? A. Chest pain. B. Palpitations. C. Syncope. D. Dyspnea. Answer: B. Palpitations. Explanation: Patients with frequent PVCs often experience palpitations, which are sensations of an abnormal or irregular heartbeat. This is due to the premature and forceful contractions of the ventricles. What is the typical treatment approach for asymptomatic premature atrial contractions, PACs? A. Beta blockers. B. Calcium channel blockers. C. No specific treatment, just reassurance. D. Anticoagulants. Answer: C. No specific treatment, just reassurance. Explanation: Asymptomatic PACs generally do not require specific treatment. Reassurance and monitoring are usually sufficient unless the patient has underlying heart disease or the PACs are causing significant symptoms. Which of the following conditions can exacerbate premature ventricular contractions, PVCs? A. Hypokalemia. B. Hypercalcemia. C. Hypothyroidism. D. Hyperlipidemia. Answer: A. Hypokalemia. Explanation: Hypokalemia can exacerbate PVCs by affecting the electrical stability of the cardiac myocytes, increasing the likelihood of abnormal depolarizations. What is the likely diagnosis for a patient who experiences palpitations and has an ECG showing a premature beat with a narrow QRS complex followed by a non-compensatory pause? A. Premature atrial contraction, PAC. B. Premature ventricular contraction, PVC. C. Junctional premature contraction, JPC. D. Sinus arrhythmia. Answer: A. Premature atrial contraction, PAC. Explanation: A PAC is characterized by a premature beat with a narrow QRS complex and is often followed by a non-compensatory pause. This pause is typically shorter than the compensatory pause seen with PVCs. Which type of premature contraction is most likely to be benign and require no treatment in the absence of structural heart disease? A. Premature atrial contractions, PACs. B. Premature ventricular contractions, PVCs. C. Junctional premature contractions, JPCs. D. Sinus tachycardia. Answer: A. Premature atrial contractions, PACs. Explanation: PACs are usually benign and often require no treatment if the patient does not have structural heart disease. They are common and typically not associated with adverse outcomes. What is a distinguishing feature of a premature ventricular contraction, PVC, with a right bundle branch block, RBBB, morphology on an ECG. A. Negative QRS complex in lead V1. B. Positive QRS complex in lead V1. C. Prolonged PR interval. D. Narrow QRS complex. Answer: B. Positive QRS complex in lead V1. Explanation: a PVC with an RBBB morphology typically has a positive QRS complex in lead V1. This indicates that the premature beat originates from the left ventricle. In which condition are frequent premature ventricular contractions, PVCs, most concerning for progression to more severe arrhythmias? A. Structural heart disease. B. Hyperthyroidism. C. Anxiety disorders. D. Electrolyte imbalances. Answer: A. Structural heart disease. Explanation: frequent PVCs in the presence of structural heart disease are concerning as they can indicate an increased risk for progression to more severe arrhythmias such as ventricular tachycardia or ventricular fibrillation. What is the primary mechanism behind the occurrence of premature atrial contractions, PACs? A. Re-entry circuits. B. Enhanced automaticity. C. After depolarizations. D. AV nodal blockade. Answer: B. Enhanced automaticity. Explanation: PACs primarily occur due to enhanced automaticity in the atrial myocardium. This increased automaticity leads to early depolarization and contraction of the atria before the next normal sinus beat. Which lifestyle modification is recommended for patients experiencing frequent premature atrial contractions, PACs? A. Increased caffeine intake. B. Reduced alcohol consumption. C. Increased salt intake. D. Prolonged bed rest. Answer: B. Reduced alcohol consumption. Explanation: reducing alcohol consumption is recommended for patients with frequent PACs, as alcohol can act as a trigger for these premature beats. Other triggers to avoid include excessive caffeine and stress. Which drug class is often used to manage symptomatic premature ventricular contractions, PVCs, in patients without structural heart disease? A. Beta blockers. B. Calcium channel blockers. C. Diuretics. D. Anticoagulants. Answer: A. Beta blockers. Explanation: beta blockers are often used to manage symptomatic PVCs in patients without structural heart disease. They help reduce the frequency of PVCs by slowing the heart rate and decreasing myocardial excitability. What is the typical ECG appearance of a premature atrial contraction, PAC? A. P wave occurs earlier than expected with an abnormal shape. B. Wide QRS complex without preceding P wave. C. Prolonged PR interval with normal P wave morphology. D. Irregular rhythm. Answer: A. P wave occurs earlier than expected with an abnormal shape. Explanation: in PACs, the P wave occurs earlier than expected and often has an abnormal shape compared to normal sinus P waves. The QRS complex following a PAC is usually normal unless there is aberrant conduction. Which of the following is the most appropriate initial investigation for a patient presenting with palpitations and suspected premature contractions? A. Echocardiogram. B. Holter monitor. C. Cardiac MRI. D. Stress test. Answer: B. Holter monitor. Explanation: a Holter monitor is the most appropriate initial investigation for a patient presenting with palpitations and suspected premature contractions. It provides continuous ECG monitoring over 24 to 48 hours, allowing for the detection and characterization of the arrhythmias. What is a common effect of premature ventricular contractions, PVCs, on cardiac output if they occur frequently? A. Increased cardiac output. B. Decreased cardiac output. C. No effect on cardiac output. D. Variable effect on cardiac output. Answer: B. Decreased cardiac output. Explanation: frequent PVCs can lead to decreased cardiac output because they can reduce the efficiency of the heart's contractions, particularly if they disrupt the timing of the ventricles filling and ejection. Which electrolyte imbalance is most likely to cause frequent premature atrial contractions, PACs? A. Hypocalcemia. B. Hyperkalemia. C. Hypermagnesemia. D. Hypokalemia. Answer: D. Hypokalemia. Explanation: hypokalemia is most likely to cause frequent PACs because low potassium levels can increase the excitability of atrial myocytes, leading to premature contractions. What is the treatment of choice for symptomatic premature atrial contractions, PACs, in patients with structurally normal hearts? A. Beta blockers. B. Amiodarone. C. Digoxin. D. Flecainide. Answer: A. Beta blockers. Explanation: beta blockers are the treatment of choice for symptomatic PACs in patients with structurally normal hearts. They help reduce the frequency and severity of PACs by slowing the heart rate and reducing myocardial excitability. Which of the following can be a trigger for premature ventricular contractions, PVCs, in healthy individuals? A. High altitude. B. Excessive caffeine intake. C. Hyperlipidemia. D. Chronic kidney disease. Answer: B. Excessive caffeine intake. Explanation: excessive caffeine intake is a common trigger for PVCs in healthy individuals. Caffeine can increase the excitability of the heart, leading to premature contractions. Which finding on physical examination might suggest the presence of frequent premature contractions? A. Regular pulse. B. Pulsus paradoxus. C. Irregular pulse. D. Bounding pulse. Answer: C. Irregular pulse. Explanation: an irregular pulse on physical examination might suggest the presence of frequent premature contractions. This irregularity is due to the early and atypical beats interrupting the normal rhythm.